The data we are using are primarily image-based, so radiologic examinations and electronic health records like radiology reports. The images come from the PACS system of the hospital. This is the usual system hospitals store their radiology examinations in. They are exported with the help of the PACS company, and then we anonymize them, usually already during export. So a radiology image usually has the image part, like the pixels or voxels, and then it has a big header, and there everything is about the patient. And this is pretty straightforward to anonymize. You can remove the patient name, you can remove the birth date, and you can replace it with a hash or just completely drop it from the examination. We prefer to use a hash because then we can link it to the electronic health records. But if a person looks at the hash, they don't know the name or something. One thing you have to consider is that sometimes you can also identify patients in the image, like facial reconstructions, and then you could identify the patient. This is feasible in CT examinations and also MRI examination of the head, but as a project focusing on kidney cancer and prostate cancer, it is not easily achievable. And while also cropping the kidney MRIs and CTs a bit, so we remove the skin border, we can ensure that also some characteristic like scar tissue cannot be reconstructed, making the images anonymized or pseudonymized, so that people working with images cannot identify the patients. For electronic health records, it's a bit more difficult to anonymize. You want to remove names, not only names of patients, but also from doctors. We are very fortunate that the data we work with is also split in kind of a metadata and the text data. And text data does not contain patient names at the institutions we get the data from, but only the information about the report. And also the dates which are mentioned, they are in a very standardized format, which is enforced by the institution, so it is straightforward to remove those. To be on the safe side, we don't remove, but replace. We replace this name with another name, so even if somebody should find a name which would correspond to a real patient, it's no way to tell that this is a real patient, because every name you find could be made up. So this is a way to be more safe, that even if your pipeline fails in a few cases, it's very sure nobody would recognize that this could now be a real patient name. And the same for dates. By switching up the days or the month a bit, you cannot really pinpoint this examination to a specific date or patient. Our data comes from our partner hospitals, which are located in Germany, in Greece, Italy, in Spain, and in the Netherlands. And we strive for a representative patient collective from all those countries.